Good afternoon. Today we will be covering induced hypothermia after cardiac arrest, and this presentation was compiled by the Athens CNL students, April Childs, Amy Eaton, Melissa Hesenthier, Ivy Howard, Jen Joshi, and Kayla Meek. Before we dive into the presentation, I just wanted to take a second to go over hypothermia. Hypo means below, and thermo relates to temperature and regulation. Let's just keep that in mind as the presentation proceeds. Hypothermia, induced hypothermia, is also known as code chill, and in more recent literature it's also been termed target temperature management, TTM. Today in this presentation there will be some guided learning questions as well as PowerPoint questions in order to facilitate more learning. And the learning objectives that we will be covering today include being able to adequately pass the post-assessment test, for students to also be able to list potential complications of induced hypothermia, and the nurse will be able to have a better idea of how to take care of a patient who is in induced hypothermia after cardiac arrest, and of course to be able to identify risk factors associated with hypothermia. Bloom's taxonomy. It might look similar to Maslow's hierarchy of needs, where you have to prioritize the level of care. However, instead of that being for a nursing premise as far as priority, Bloom's taxonomy is more commonality for educators. It's a way to dive deeper into learning instead of just on the surface level of memory and understanding. You're able to go over and beyond with analyze, application, and evaluate. And throughout this presentation, the slides will be marked accordingly of understanding, which would include process, phases, effectiveness, outcomes, and care. Analyzing would include the clinical guidelines and the application of knowledge, some questions at the end of the PowerPoint. And this is something that is very useful in order for long-term learning. Okay, so without further ado, I would just want to go over what therapeutic hypothermia is, and that's for short is TH. And there was a recent article from 2017 from the American Nurse Today, and it defines therapeutic hypothermia as reducing the core body temperature typically to a range of 32 to 36 degrees Celsius, and the patient does not regain consciousness even after spontaneous circulation after cardiac arrest. So if we need to think what is normal temperature usually, and that's about 36 to 38 degrees Celsius. So this is significantly lower. And by utilizing therapeutic hypothermia, the purpose is to reduce long-term complications. We have to act aggressively, and in doing so, we'll be able to improve the patient outcomes for post-cardiac arrest. And then here's just a picture illustrating the brain being in ice and how we need to be able to get out of that state as quickly and effectively as possible. The process of this includes after cardiac arrest. Of course, the patient needs to be assessed. That's the first part with the nursing process. We need to always assess. From there, if the patient meets the criteria, then we'll be utilizing multiple cooling methods to employ, which could include cooling blankets and therapeutic hypothermia. And here's just a picture illustrating the transition from if a patient's going in cardiac arrest, then we might be able to complete CPR until someone else is able to take over. And then from there, therapeutic hypothermia and then other cooling methods. And here's a picture to illustrate how hypothermia works. And it's to show there's 3 different ways to hypothermia therapeutic hypothermia works. There's the water blanket and cooling caps, which I'm not sure about you, but sometimes after I work out for a while, I'd once playing tennis, going for a run, or just even being at the beach, sometimes it's really nice to have a cooling cap. So that's a way to be able to remember it. And then there's the cooling catheter, which is cooled with saline solution injected into the bloodstream, and it's through a catheter and it goes into the femoral vein. And then last but not least is the transnasal evaporative cooling, and that's a tube that's inserted into the nasal cavity. It sprays a mister, and that's able to cool the brain and the bloodstream. The mister might be something that we would be able to correlate with if we had a sinus infection, or we're getting sick frequently and we're not sure if it's an allergy based, with having those different humidifiers and misters or even nasal spray. So again, how therapeutic hypothermia works is by trying to get the brain back to an optimal temperature to cool it down, and those temperature ranges are approximately 32 to 34 degrees Celsius, and the three methods are water blankets and cooling caps, the cooling catheter, and the transnasal evaporative cooling. There are three phases associated with induced hypothermia. There's induction, maintenance, and rewarming. Induction, hence the name induction, is more of an introduction phase. So that means more or less of what can we do to lower the body temperature. And that could include using the intravascular catheter, cooling blankets, ice packs, similar methodologies that were previously mentioned in the last slide. And if need be, the sedation and neuromuscular blockade are also possibilities. Secondly is maintenance, and that maintenance is for regulation. So you want to be able to sustain that temperature. The temperature, ideally, you want to have within a target range for up to 24 hours or 1 day, and that's from when the induction begins and when that patient reaches the target temperature. And lastly is rewarming, and you want to only rewarm slowly. The temperature would only be increased from 0.15 up to half a degree Celsius per hour to prevent electrolyte shifts that could cause cardiac arrhythmias. And remember, cardiac arrhythmias tend to be associated with potassium, and normal levels for potassium are 3.5 to 5 milliequivalents per liter. So that's something that as nurses we would need to be constantly assessing and checking the lab values to make sure that there's not too much of an electrolyte shift that could cause the patient future complications. And here's a quick clip on therapeutic hypothermia. For time purposes, I'm not going to click on this video, but it's something that all of you, if you have a moment, can just watch. And just real quick, this picture illustrates the 3 steps, and there's specific pads similar to ones that when we were in CPR class, we'd use the pads that would either go around the thighs or the chest. And then secondly, there's the hose connected to each pad to distribute the temperature. And then there's the thermometer, the little probe that's in Fahrenheit 96.7. So we're able, as nurses, to adequately be able to give objective data to see where the temperature is, if the pads are secure, and to also be able to look at the patients, do a skin assessment, do a neurological assessment really quick to check in to see how the patient is sustaining the therapeutic hypothermia and whether we need to utilize other methods. The effectiveness includes, is there increased available glucose? We need glucose in order for our brain to sustain optimal function. By there being available glucose, we would be able to reduce the metabolic demands of the body. With the body not needing as much demand, we would then be able to reduce our oxygen consumption, so we'd be able to operate at more optimal levels, and from there we'd prevent ischemic reperfusion injury since we'd have better circulation throughout the body. And then from the body being able to maintain a better rate of homeostasis, we'd be at less rate of inflammation, and then we'd also decrease the neuroexcitability. The outcomes, here is a picture of a patient who received therapeutic hypothermia. The nurses are in the room making sure that the patient is not too exposed, checking the lines, checking in on the patient, doing the vital signs, the assessment checks, neurological. And ultimately for the outcome, we want to improve survival rates. In addition to just that, we want to also make sure we're able to the best of our abilities as nurses to improve the neurological function post-cardiac incident. So first we might, of course, keep the patient alive, and then from there be able to see what can we do at a neurological level. And of course, with anything in life, any kind of procedure, there's risk and complications associated with it. There could be a cardiac dysrhythmia, which would ultimately result in a prolonged QT complex arrhythmia, which that's a way of saying it impacts the repolarization of the heart. If we think back to electrocardiograms and the graph, that is another way of saying it takes longer for the heart to recharge between beats. Other complications might include cardiac electrical storms, ventricular fibrillation, in which the patient's level of consciousness is, there's no level of consciousness, there's no pulse, and we need to act extremely quickly with the defibrillator, AED, and CPR. And that's when there's early repolarization syndrome. The patient may also be at risk for seizures and cardiac dysrhythmia, the electrolyte imbalance, and then infection. Nursing care, we always want to make it patient-centered. So we do want to make sure that we're including the family and adhering to the cultural and religious practices. We want to do our frequent checks, which would include strict eyes, nose, frequent vitals, maintaining the hypothermia temperature, which is 34 to 36 degrees Celsius, medication management, doing our 6 checks each time we give the medication, being very vigilant on monitoring our lab values, assess for shivering, and just continue to check in on the patient to see what else can we do to make methods more comfortable for the patient. The family has a lot of say in the impact that they can play. The family might not really know what to do in this instance. They might feel at times detached from the sibling or loved one, feelings of hopelessness, stress, anxiety. They might not know what all the machines mean or how to make these connections. So that's where nurses can come in. Nurses can teach the family about these lifestyle changes. There's times where we just are in situations that could have been avoidable if we knew about how to dress appropriately, what we could do to increase the mobility to decrease their chances of getting cold, improving our nutrition status, and making that connection with the patient and the families to maintain that level of hope, and just to be able to have more educational methods and care goals, and also to educate the parents about pain management, and that if the patient does need pain, that we're going to be monitoring and doing it within reasonable means. The clinical practice guidelines, there's multiple studies that have been conducted from the American Academy of Neurology, the American Heart Association, and the American Academy of Neurology has endorsed therapeutic hypothermia for post-cardiac arrest patients, so that's excellent. And as we previously mentioned before, the American Heart Association wants the target temperature 32 to 36 degrees Celsius for 24 hours for non-responsive patients. And the 24-hour period would be part of the maintenance phase. And additionally, the American Academy of Neurology has shown a strong correlation of evidence that therapeutic hypothermia has been effective to improve the neurologic outcome and survival compared to normothermia, and that it should be a viable option offered to patients. Here's an adult immediate post-cardiac arrest care algorithm. There's multiple steps to use. You start from the top of is there a return of spontaneous circulation, and then you go down to optimize the oxygenation, and then we check to treat the hypotension, and from there 12-lead EKG, and then it goes depending on whether that's a yes or no. The patient might be going through coronary reperfusion, then just going off of the follow commands, then initiate target temperature management, and advance the critical care. And there's all the reversible causes and doses and details on the sidebar of this illustration. And here are some questions to just assess your knowledge. So the first question is, using your knowledge of nursing care and potential complication for individuals receiving therapeutic hypothermia, find 3 values that are outside of normal limitations. A blood pressure of 110/72, a heart rate of 72, respiration rate of 14, temperature 38 degrees Celsius, SpO2 96%, telemetry of a prolonged QT interval, or white blood cell count of 15,000. And again, there's 3 correct answers. Okay. 38 degrees Celsius, prolonged QT interval, and the white blood cell count of 15,000. Heart rate, normal for adults, with limits would be 60 to 100. Blood pressure optimally for adults is less than 120/80. SpO2, 95% or higher in room air. WBC count is 5 to 10,000. So that would be elevated, which might show signs of infection or hypothermia, and the temperature of 38 degrees is high, and the prolonged QT interval, which could cause cardiac dysrhythmia. So again, the 3 options that are outside normal limits are the temperature, the telemetry, and the white blood cell count. And please let me know if you have further questions on this question. Another question is, by using your thorough knowledge, determine the risk factors of hypothermia from this case study below. I'll just take a minute to read this and see what you come up with. A 69-year-old female is 5'10" and weighs 120 pounds. She's a retired librarian and lives with her son. Her husband passed away from a stroke 2 years ago. She has a history of diabetes and alcoholism. She eats 2 meals per day, with her favorite meal being steak and potatoes. She's an active member of the grassroots movement and brings a jacket to activities. And the answers would be BMI, alcoholism, poor nutrition, and inadequate layers. Her BMI would be the height to weight comparison. She would be underweight. She does not seem to have very good nutrition, mainly eating steak and potatoes. That's going to lack a lot of vitamins and minerals and calcium and a lot of foods that she would need for her age. She said she just brings a jacket, which that might not be adequate enough. And so she has some ways that she can improve her risk factors to decrease her chances of hypothermia. Another application question is, sequence the complications of induced hypothermia in order from greatest to least. The temporal body temp of 99.2 Fahrenheit, increased confusion, loss of consciousness, mild shivering. Give you just a minute to fill that out. And let's see what the answers are. 3, 4, 2, 1. So loss of consciousness, that would be, without a doubt, the best answer. We need to respond to that immediately. Secondly, mild shivering is a mild sign. Increased confusion. And then the temporal body temperature, that's a normal temperature. Here are our references, and please let us know if you have any questions. Thank you.